Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to another beautiful episode of Ask the Pediatrician Hour. I am Bimi Salaboide. I'm a pediatrician, and I want to specially welcome you, irrespective of whichever platform you are listening on or you are watching at this time. Thank you so much for joining us on this brand new episode of Ask the Pediatrician Hour. Ask the Pediatrician Hour is brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is committed to the health and welfare of all children globally, especially in sub-Saharan Africa, where many of our children still die from preventable causes. And we do that through our health education and information programs, including this one that you are listening to right now. We also do community medical outreaches in indigent communities. So thank you so much for joining us. You can watch this program live on our Facebook page and Facebook groups. Also, you can watch it on Fresh Waves Radio Facebook page as well. And I know some of you are watching on our YouTube channel right now. I want to say thank you. But you can also listen on Fresh Waves Radio every Thursday at 10 a.m. or on my podcast, Ask Dr. Bemi ATP podcast. So you can catch up on past episodes that you may have mixed. We have discussed very important topics in the past, and I'm sure you will learn a lot. So I want to encourage you to share this video, share the link, whichever platform you're listening to right now, and invite your friends and family to join us as we begin to talk about another very important topic as it relates to the health of our children. And of course, and answer the questions. We'll obviously have a day where we can do a live session of question and answer on this platform as well. So thank you so much for joining us. Okay, so today we're going to be talking, for those of you who are watching, you can see the topic right behind me. And of course, for those of you who already saw the flyer as well, so you know what we're talking about today. On the 2nd of April, that was on Sunday, that was World Autism Day. It's a day set aside every year to create awareness about this condition we call autism spectrum disorder. So every year, April, in fact, the whole month of April is designated for autism, but more importantly, the 2nd of April is the day set aside for creating awareness about autism. And this year's theme is color. All right, so that's quite an interesting choice of title or theme for this year's celebration of the World Autism Day. And on Sunday, that same Sunday, I was with a group of professionals, mothers, and I was curating awareness about autism. And I also decided that I will still do that same presentation for those of us on Ask the Pediatrician Hour. So I think it's fitting that today I'm going to be talking to us about autism spectrum disorder. And most of us are quite familiar with the word autism, but the full name is actually autism spectrum disorder. And it's one condition that seems to be increasing. And thank God for this kind of awareness. Many more people are now familiar with autism, and I guess many people also have more questions about autism. So today we're just going to talk about autism simply as possible, and we're going to talk about how do we recognize children with autism, how do we support children who have autism. So I want to encourage you to listen. I want to encourage you to invite friends and family who can still join us so that they can learn about this very, very important topic. And I'm also going to be sharing that slides from my presentation on Sunday. So I hope you will learn a thing or the other. All right, so let's talk about autism. All right. What is autism? All right, that's where we're going to start. And if you look at this slide, for those of you who can see, I've shown a picture of about 5 dogs in a row, and 4 of them are facing one way and one is facing another way. So we tend to look at autism as seeing the world from a different perspective. I guess that is a way of looking at the definition of autism. It's about seeing the world in a different perspective. So those on the autism spectrum interacts with the world slightly differently from those who are not having autism spectrum disorder. So, but just for clarity, we can describe autism as a group of disorder, or what we call neurodevelopmental disorder, that affects some certain areas for the individuals, their social interaction, their communication, and behavior. So people on the autism spectrum disorder tend to struggle a bit in terms of social interaction, in terms of communication, and in terms of their behavior. So those are the 3 cardinal features you see in people on the autism spectrum disorder. We say autism spectrum disorder is a neurodevelopmental disorder. That means it's something present from childhood, is something the person grows up with. So both children and adults will have autism, and we don't tend to say people are no longer on the spectrum. In other words, when somebody has autism spectrum disorder, we believe they have it for life. So those who have autism, whether adults, whether children, tend to struggle with interacting with people. They struggle with communicating, and they may also have their own peculiar way of behaving or of doing things. And that is what autism is. And now the question is, how common is autism? You know, autism is very common and it seems to be increasing. People kept asking, is it that we're diagnosing more cases of autism, or is there truly an increase in autism? I actually think both are correct. When I was in medical school, then we used to say, that's over like 2 decades ago, we used to say everyone in 140 children in the United States have autism spectrum disorder. However, now, as of 2023, it is 1 in 36 children are diagnosed with autism spectrum disorder. This is according to the Center for Disease Control in United States. That is the current figure, from 140 in 2000 to about 1 in 36 in 2020. That is a huge, huge increase. In the United Kingdom, they think that about 700,000 people, adults, children with autism spectrum disorder, which comes to about 1% of their population, and that was in as of 2011. Of course, in Africa, in Nigeria, we don't have exact figures of how many of our children have autism spectrum disorder, but I will imagine our figures will be close to those of the United States and the United Kingdom. Maybe we don't um, document it, or maybe some of our children are not even diagnosed, but we know that there are many people who have autism spectrum disorder. I definitely was seeing a lot more children getting diagnosed when I was in the Lagos at the Lagos University Teaching Hospital in Lagos, Nigeria. All right, so we know that autism, many people are affected by autism, and it seems the figure is increasing. And what other things is that boys tend to have autism more than girls. In fact, we put the ratio about 4 to 1. So 4 to 1, boys are 4 times more likely to be diagnosed with autism than girls. This is actually true figures. In other words, there are more boys with autism than girls, but also because sometimes girls tend to mask their own symptoms, and so sometimes they may be mixed as well. All right. In Africa, I guess one of the challenges why we don't really know how many of our children have autism is that we don't even actually have a right local word, like what is our native word for autism. I remember being in a conference in Ghana in 2014. It was an Autism in Africa conference, and we have pediatricians and specialist psychiatrists from over 10 African countries, including South Africa, Nigeria, Ghana, Uganda. And we were trying to figure out what is the local word for autism in each of those countries. And there was no country that has a native equivalent of the word autism. So that means a lot of people will not even know what autism is, and that tells us why we may not have the true picture of how many of our children are actually on the autism spectrum. So a lot of children will have autism in places like Africa because we don't have the word for the autism. People tend to think they are deaf, or people tend to think they are dumb, or people think they have intellectual disabilities, or what we used to call mental retardation in the past. But most of the children actually do not have any of these conditions, but they may actually have autism. And what that means is a lot of our children are not recognized, and they are not diagnosed, and they are not getting the right intervention. I see a lot of questions on ATP, and immediately I start reading, I'm already worried about autism, and I'm telling the mom, you need to take your child for autism assessment. All right. So, like I said, anyone can have autism. It can affect boys and girls. It can affect any socioeconomic class. So, but many people are diagnosed with autism in childhood. So, usually before the age of 5, most children would have been diagnosed with autism. Autism is not the same thing as intellectual disability, but quite a number of people on the autism spectrum, about 31% of them, may have intellectual disability. Okay, some may have, but some are actually very intelligent and have about 44% of them actually have above average, average or above average IQ scores. So autism can affect children with learning disability or intellectual disability. It can also affect children who have normal intelligence. And this is important for people to recognize that autism spectrum disorder is actually a spectrum. So all the children are not the same. And I guess this is also create some confusion for parents. So, but it's important for us to realize that autism is a big there are many different variety when it comes to autism. It affects all economic groups, socioeconomic groups. So whether the poor, the rich, so it's not a disease of the poor, it's not a disease of the rich. It affects all ethnic groups as well. And unfortunately, people that are obviously poor or minority tends to get diagnosed later. And of course, early intervention helps. And this is why it's important for us to create this awareness so that people will know more about autism spectrum disorder, and we can get the right support for uh, children on the autism spectrum. And of course, unfortunately, we don't have like a cure or a drug that we can use to cure autism, but I will tell us how autism can be managed. All right, now let's continue. In terms of what causes autism, I guess that's a natural question people always ask. Doctor, why did my child have it? And especially mothers, because sometimes mothers want to, will I say, blame ourselves for, wow, I shouldn't have this. Sometimes it's because I didn't do this, it's because I didn't take folic acid or not. No. The short answer, and I guess maybe the simplest answer I always give to parents, that we don't know. We don't know. We can't say this is the specific cause. Like for example, if you have malaria, I can tell you is because you got what we call malaria parasite plasmodium introduced into your blood through mosquito bites, and that is why you have malaria. But we don't have that kind of answer of what causes autism. However, we have some idea of what could be happening. Number one, we think there's some genetic factors when it comes to autism. We know that there are some genes involved, and this has there are many ways by which we know there must be something genetic involved. Number one, boys are more affected than girls, so there must be something in the genes. Of course, we also find that people that are older parents tend to have children who have autism spectrum disorder. We've studied twins, so we find out that for twins, identical twins, 36 to 95% of them we have autism. I have like 5 sets of twins that I've managed, and they both have autism, and they are more or less exactly the same. So there must be something genetic going on. Even those who are not what we call monozygotic twins, those who are not identical twins, even then the rate in them is still as high as 31%. And of course, there are families there who they have like 3 children, 4 children, or maybe all the boys have autism and all that. So we definitely think autism definitely has some genetic condition, connotation, or in terms of the cause. And we found out that there are certain genetic disorders that people that have those genetic conditions tends to have autism as well. For example, Fragile X syndrome, Rett syndrome, and many other genetic conditions like that. We found out that the rate of autism in children or adults who have this particular genetic conditions tend to be higher. So we believe there is some genetic factors, but we don't think it's only all genetics. We also believe that some environmental factors also have a role to play in autism. So, for example, we find out that children who are exposed to alcohol, whose mother drank alcohol when they were pregnant, and end up having fetal alcohol syndrome, they also tend to have autism more than children who do not have fetal alcohol syndrome, or children whose mother, for example, have epilepsy and they were on valproate, which is one of the drugs we use to treat epilepsy. And we found that children were exposed to it in the womb of their mothers also tend to have more autism. The same thing with children who did not cry at birth, or children whose mother have significant medical challenges, hypertension, diabetes, obesity when they were pregnant. The children tend to have autism spectrum disorder. So we think there's a role for genetics, and there's also a role for environmental factors. So before I go on to signs and symptoms. So, if you put it this way, we can just say that autism is a genetic condition that have some environmental modification. So there's still a lot of research going on the cause of autism, on which genes, because again, that's what we say it's genetic. We don't have only one particular gene. There are over 200 genes that have been identified when it comes to autism. And so, and when we say environmental, how come some people who are exposed to the same environmental condition do not have autism, and why some have it? So it's a mix, and there's a whole lot going on. But as of today, we don't have a specific answer, but we know there is strong genetic factor, and there is some environmental influence. But the short answer is we are not 100% certain what the cause of autism is. All right. Now, what are the symptoms or what are the signs? How do you know a child who has autism? And now, I always like to start this part by saying there is no one single symptom or one single sign that once you see it, it means that person has autism. I always like to say that because a lot of people will say, oh, this child does not give eye contact. It must be autism. And there's a day I was answering a question on our group and somebody was trying to post, oh, this child has autism. And I have to quickly delete that answer. You cannot say a child has autism just because the mom or the dad has written a couple of symptoms. That is not how the diagnosis is made because there is no single symptom on its own that is 100% specific for autism. They may be suggestive, but they are not necessarily. So there are children who do not have eye contact and yet do not have autism. And there are children who have eye contact who has autism. So the converse is true. The presence of one particular feature does not exclude autism. So the fact that a child has eye contact does not mean the child does not have autism, or the fact that the child can talk, because a lot of parents get confused. So say, oh, but my child is giving eye contact, but my child is talking. So why are you saying my child has autism? So again, there is nothing a child can do that because the child can do that, it automatically exclude autism. No. Again, also the presence of any particular sign, any of these signs I'm going to mention, does not automatically means the child has autism. It is very important that we get that. So for us to say a child has autism, the child needs to have several. Okay, that's the key word. The child must have several of these symptoms, and it must cut across all those what we call the criteria or the diagnostic criteria for autism. So the child must have enough under each of those categories, what we call the social communication, social interaction, and then the repetitive behavior. The child must have from both sides and must have enough from both sides. So one alone does not make the child has autism, or the absence of it does not mean the child does not have autism. So that is why autism diagnosis has to be done after a thorough assessment by professionals who are trained to recognize these features and who are able to tick the boxes that a child meets the diagnostic criteria for autism. So that is the most important emphasis I think I want to lay as regards symptoms. But what are the symptoms? Again, autism is a spectrum. So for each of those challenges, it varies from one hand to another. And we always like to say that when you've met a child with autism, you've only met one child with autism. You cannot say you've met all the cases of autism. So autism is a spectrum, all right? So you can have the spectrum vary from when it comes to social skills, we always see people with autism struggle with their social skills, but the way it manifests can be different. So you can go from people who are completely oblivious of other people who will not even look at any other person, or you can go to the people who are like over, too much in your face, too much, and like, they are still all social interaction difficulties, either none at all or too much. They are just in your face. There's no there's no filter. They can say anything, or they can talk to anyone, they can go away with anyone. That is the spectrum. So it's a spectrum. The same thing for behavior. It's not everybody that will be aggressive. So you have people who are very aggressive, who can be very destructive, and then you have this hot person who is just like, you can't even know they are there. So that is how autism is. It's the same thing with communication. So when we say communication difficulties, you can go from a child who is completely nonverbal, who is not talking at all. That's a part of autism. Or you can go to the extreme of the children who are talking and they are using very complex grammatical expression, very complex vocabulary. I know children who can tell you the names of all the various dinosaurs and all that, and yet they can't even call mommy, but they can tell you all the various, all those dinosaur, the different type, those complex names of them. They know everything, but they can't call their own mother, mommy, I want this. That is how autism is. So it's a spectrum from a child who is not talking at all to a child who is talking like a professor, very advanced, beyond even what every other person can understand. That is again a spectrum. Again, they can have issues with their motor skills, from a child who is awkward to a child who is very versatile, agile. There are children who will see a picture and they can paint it in 1 second. They can remember everything. Whereas there are some children who can barely hold a pen. So again, spectrum. Also, we have in terms of what we call sensory sensitivity, they have what we call hypersensitivity. There are children who cannot tolerate even the littlest sound, that maybe the clock ticking, they can hear it, and they can't even stand it. And there are children who the whole world may be crashing and burning, and they are not even bothered. So it's a spectrum. So we always have to remember that as parent. And then also I've mentioned about the IQ. So there are children who are extremely, extremely intelligent. People like Albert Einstein, for example, is believed to be on the autism spectrum. People with very extremely high IQ. And there are also children who are very low IQ, who are, have severe, profound intellectual disability, who cannot do anything, who needs other people to do things for them. So autism is a huge, huge spectrum. All right. So, but no matter where the child is on the spectrum, there are three things they will always struggle with. Everybody who has autism will still struggle with their social interaction, whether it is too much or too little. They will still struggle with their communication, whether it's not talking at all or talking way above people. No, everything is black and white. No, nothing in between, or taking things very literal. No understanding of implied meaning or jokes and things like that. And then behavioral issues, their way of doing things, stereotypical behavior or interests. So, or if those three are not present, then it's not autism. So no matter where the child is on the spectrum, they will all struggle with social interaction, social communication, and they will have that stereotypical behavior issues before we can say the child has autism. And this behavior or these issues, these difficulties would have been present in childhood before they are 3 years old. So even though sometimes we don't diagnose some people until they are adults, the signs or the symptoms of autism would have always been present. So the mother will remember, oh yes, when it was this, we think this. So that is why sometimes that autism is not diagnosed until the demand on the child or on the individual outweighs their natural reserve. So that is about autism. So what are the things you will see for each of these areas? Like I said, they will also with what we call reciprocal social interaction. So for example, children on the autism, when you try to point out something for them, they may not be able to follow and look at what you are trying to show them. Say, look at that. They can't follow to look. Or sometimes their facial expression is just neutral. You are trying to, when somebody says excited, you're trying to show, look at this. There's no excitement. You give them Christmas present, they are not excited about it. They just neutral, and sometimes it's not appropriate. Or sometimes you are trying to tell them off for doing something, and they're just laughing and you don't understand why the child is laughing when they should be sad or sober. And also they struggle with interaction. They may not be interested in other children. If you see other children playing, you tend to see the child on the spectrum, on the periphery. They are just in their own world. They are not playing together with other children. And when other children try to get them to play with them, sometimes they may just ignore them, or sometimes they want to play with other children, but they just don't know how to. And they will do things that the others may find very uncomfortable, and or maybe too much. for them. So they may not be able to offer. You tell them share things, they don't understand why they have to share. They may struggle with sharing, even with their own siblings. They take something, they think everything is their own, and other people should not share, even though it's something that belongs, maybe for example, in school to the whole class. A child on the spectrum may believe that that is for them, and they will not share with any other person. They may, if somebody is crying by their side, they may not know how to offer them comfort or say sorry, or they may just ignore. Sometimes they do not give eye contact. They will not look at you when you're calling their name, or even when you're doing things with them, they are more focused on the object or whatever you're doing with them rather than the person who is doing things with them. They can walk all over you to get to where they are going. They may not see people as people, they just see you as something. They can just, for example, in nursery, sometimes children on the street, they can just climb or walk all over their colleagues, their peers, to go get whatever they want because they are so single channeled and self-directed. Sometimes they don't like cuddles, they don't like to be hugged. Parents, want to hug children. Grandma is visiting, so come for a hug. They won't be bothered. They may just take themselves away from maybe social gathering, birthday parties, and they're just in them. So these are some of the features you may see on a child who is on the spectrum. These are social interaction difficulties. Also, communication. I've already said that it's either the child is not talking at all. This is one of the features that most parents usually come to us first with. They will like, oh, my child is not talking. He's 2 years old, she's 3 years old, and the child is not saying any word at all. Or sometimes they struggle with, sometimes when a child is not talking, if it is like deafness or that thing, the children will compensate by using what we call gestures. But children on the spectrum, they don't use gestures. They won't point. They won't wave goodbye. They don't nod. They don't shake their head. No gestures. If you see something, they are not pointing out to show parents and all that. Or sometimes they say things. They just say things. It's black and white. They see somebody who is very fast, like myself, and like, oh, why are you so fast? Why are you so like this? They don't see it like, oh, you don't say things like that to people in front of them. It's like there's no filter. They just say what it is that is in their mind. Sometimes they do what we call echolalia. That you say, how are you? Instead of them to say, I'm fine, they go back, how are you? They can echo what they watch on the TV or what they've had. Some parents also, my child is very good. He knows all his ABC, he knows everything, he can recite everything. Most of the time, it's just memory. Those children just memorize those things and they just regurgitate them, but they can't even use words from those things that they are reciting. They can't use it to have a conversation. They can't talk about it. Sometimes they make up their own words. They call things by their own name. Sometimes they have unusual accents. So some children talk like they are talking like the cartoon characters, or they talk with this high pitch tone of voice and all that. Sometimes you tell them things, they struggle to understand jokes. If you tell a child on the spectrum, for example, it's raining cats and dog, they will, most people know that means you're talking about raining a lot. But for them, they may actually think the cats and the dogs are literally falling from the sky, so they'll go look out for it. Where's the dog? Where's the cat? Those kind of things. So they may struggle with understanding the hidden meaning or, the implied meaning of words. So sometimes you have to very literal with them, and they may have trouble having conversation. Instead of what happened in school today, they can't tell you, they'll just kind of ignore. So these are communication difficulties you see in children with autism. So one, they struggle with social interaction, then they struggle with communication, and the third one is the behavior. There must always be behavior issues, and they tend to have what we call repetitive behavior or what we call restricted behavior. They just want to do things in a particular way. For example, there are children who will only eat one particular food, or that is the only food they will eat for breakfast, and it has to be the same food for breakfast all the time, nothing else. And sometimes some, cannot, they want you to go to not just even a particular food, it has to be a particular brand. So I know parents who will tell me their children will only eat McDonald's chips. Let the mother bake it, let her do it like McDonald's, even buy a box of McDonald's and put it inside. The children will still know that this is not McDonald's zone and you have to buy McDonald's zone, and that's the only one they will eat. Okay. Some children, you have to follow a particular way to school. even if the mother say, okay, let's just quickly branch somewhere else, I want to buy fuel, they can't stand it. If you say you're going to school, you have to follow that way and you must go to school, and you can't branch off, you can't take another. Some children have very strong attachment to certain items. So they have some items that they always take with them everywhere they go, or maybe when they have to sleep, it has to be that particular blanket, or that particular toy must be with them. Some children must always hold something in their hands. They can't go anywhere without holding something in their hands. And then some children have this interest in certain things. I know children who knows like all the underground, all the colors, everything, things that I just like. Some children is the cars. They know all the cars, all the brands of cars. Some children is the dinosaur. Some children is Peppa Pig. They know everything that, they will know everything more than anybody else about that particular area of their interest. And that is all the thing they want to talk about. That's all they want to, or maybe something they want to play with all the time. I have children who are into Paw Patrol, and everything is Paw Patrol, their shoes, their jacket, their bags, everything has to be Paw Patrol. I know children who will not try new shoes. These are peculiar behavior that we see in children who are in autism spectrum. Then you also do some repetitive behavior like flapping their hands. Some people, they rock, they spin around in circles. Some children walk on their tiptoes. So all these unusual behaviors, we must see them for, in addition to the social interaction difficulties, in addition to the communication difficulties, for us to say this child has autism spectrum disorder. And autism is not one alone. One thing with those of us in developmental pediatrics is that most of our children don't just have one condition. They tend to have multiple conditions. So a child will have autism spectrum disorder and also have intellectual disability, and maybe also has ADHD, and maybe also has anxiety disorder. So sometimes they have a mix of all these symptoms, and sometimes parents can become confused. So some parents, I remember one of my parents was telling me, they were telling me my child has ADHD, 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 but you will not notice that even when they're treating child for ADHD, the things are not always this. There are still some issues there that are not going away. So it is not unusual for children on the spectrum, in addition to the primary autism diagnosis, to have other diagnoses like ADHD, learning difficulties, and all that. Of course, some children don't have any of those additional issues. They only have the autism, and that's the only thing that they have. All right, but it's just for parents to know, because sometimes when we are giving these diagnoses, we will tell you it's not just autism that is there. There are other issues as well that is there, and that we need to also diagnose. And sometimes we need to manage as well, because if we don't manage those other issues, then the child may still struggle despite having the autism diagnosis. And that is why, again, people cannot make diagnosis just because of what parents have said. We need to have a formal assessment by the specialist before we can die, because the specialist will be able to know this is autism with ADHD, or this is just autism alone, or this is autism with learning difficulties, or just autism alone, or autism with normal intelligence, or autism with anxiety. So we'll be able to clarify all the various uh, condition present. So these are all the possible issues that children with autism may have: anxiety, ADHD, ADD, ODD, Tourette syndrome, obsessive compulsive disorder, developmental coordination disorder, what people call dyspraxia. You can also have people who have autism who are also very gifted. I know it may sound unusual, but being a gifted child is actually like a developmental disorder on its own, because they also have their own challenges. Even though people will like, oh, that's nice to be gifted, but they struggle in certain areas. They may have sensory processing difficulties, auditory processing difficulties, depression. So all these things can coexist with autism, and sometimes they kind of overlap, and that is where the professionals come in. However, for parents, the most important thing is to pick up autism early. Like I said, autism is a neurodevelopmental disorder. The symptoms have always been present right from the beginning, and most mothers, most fathers even teachers, they'll start noticing all these signs, but sometimes they are not sure is there something there or not. So the most important thing is to pick up these early signs. And if you notice these signs, we are not saying you should do the diagnosis, but you should advise parents, or parents, if you're the one picking up, you should come to the professional so that we can do a formal assessment. What are these early signs? No eye contact. You notice your child is not giving eye contact. As early as 7 months, babies can give eye contact. When you call their name, they turn and they look at you. 7 months old. So if you're 1 year old, 2 year old is not giving eye contact, or children are not babbling, even when they're not yet talking, they should be babbling from like 9 months old. So if they are not babbling, it's a concern. If children do not respond to their name, like I said, from early as 7 months, they respond to their name. If you see your child doing repetitive behavior, lining up toys, doing all those, they are showing what we call sensory sensitivity, maybe to light or to noise. They are covering their ears to those loud noises. These are signs. For those of you who are watching, you can see a picture of this little toddler who has lined up all his toys in one line. And if you dare take any out, they become very upset and they will have a tantrum. Those are warning signs of possible autism, and that means the child needs to have an assessment. The children don't smile back. Usually, even as early as 3, 4 months, you smile to children, they smile back at you. It's one of the earliest social skills. So if your child doesn't like to look at you, doesn't like to smile back at you, even when you babble, children, you can be having conversation with them, you will laugh at them, you do your baby talk with them, and they also do the same baby talk back at you, and they find it very interesting. If your child is not doing that with you, even as babies, even as early as 1 year, it is a problem. Children cannot do pointing. Usually when children cannot talk, they point. As early as 1 year, they start to point to ask for things. By 18 months, they start to point to show us things. By 1 year, they should be waving goodbye. If they are not doing all that, or they are not talking at all, by 2 years, or they are not interested in other people, grandmas come, they don't seem to be bothered. You come back from work, all the other children are running to say, mommy, welcome, mommy, welcome. The other child just keep playing as if nothing has happened. Those are early warning signs for the preschoolers. That is when we want to diagnose autism. We want to diagnose them early. So these are signs we will pick up in children less than 2 years old. Or they don't do pretend play. Most children will pick up a pencil and pretend to be using a microphone. As a microphone, they pretend to be talking to it. Or they pick up the remote and pretend to use it as a telephone and say, hello, daddy, hello, mommy. If your children are not doing those pretend play, pretending to feed their dollies, pretending to put the dolly to sleep, pretending to push the dollies, taking it to markets, buying, all those kind of play that children should be doing. If you are not seeing those pretend play, those are signs that there may be something wrong, or this child, they respond to certain sound in a very unusual way, or they are so scared of certain things that you don't expect children to be scared of, those, or they do unusual thing with their hands, they flap, or they spin around in circle, or they're always walking their tiptoes. These are early signs, warning signs. It means we are not saying the child has autism yet. We are saying this child needs to have an assessment and you need to take them to house. I actually have a video here, which unfortunately I won't be able to. I don't know whether I should play it. Okay, I won't be able to play it for us, but I'm sure many of us have seen this video on TikTok, on YouTube, and everywhere. And you can see this child showing all these signs of autism. If you just Google it, I'm sure you will see. I just want to show us a video of all these picture of a child who is having autism. Let me see if I can play it as a video file. All right, let me see if I can do that. When it's uploading, I will play it for us. So if you see this, okay,
Madison,
yes. For those on
Madison,
listening, you may not be
Madison,
able
look
to
at mama.
see, but you
Madison.
can. So this is a child. The first slide was a child not responding to the name, and the second was showing the child lining up the choice, and this one is showing the child um, uh, putting herself upside down. This one is the child spinning around in circle. This is a picture of the child flapping their hands. I will encourage everybody to watch the video on our
Happy birthday,
YouTube
babe.
or
Look at Madison.
Facebook group for those of
Big
you who are
creepy eyes.
listening, so that you can see
You
the
saw that,
picture.
Mom?
Then we see the child rocking back and forth, and then you see the child spinning the wheels of a pram. They will just spin the wheels and then flap. These are all features of autism. Um, you see, the mom is trying to get the child to follow a point, and the child cannot follow a point. In this video, the child is still walking. Um, Again, these are early signs of autism in a toddler. If you start seeing your child doing several of these things, please get them assessed by the pediatrician. We'll talk about that. Uh, we see the child not talking. The child is using the hands. Instead of them to do things by themselves, they will grab the parents' hands and use their hands to do things. This child in this video is pacing back and forth, back and forth, back and forth. Again, they can't sit still. They're always moving. That can also happen in ADHD, but it's also happen in autism. And then we can see the child doing what we call hand and finger mannerism. They just move their hand in a usual way. They look at their hands in a usual way. They look at it closely. As they have no sense of danger, they can just run into the road. This child is standing right at the tip of a table and is not scared of falling. They have this sensory. They don't want to touch certain things with their finger and all that. So these are all creatures. In this last slide, you can see this child. There are three children, but you can see the child is just like in our home world, not playing together with other. You always see them on the periphery. All right, so I guess I'll go back to my slide again. So we're talking about a child on the autism spectrum. So once you see these symptoms, once you see this sign, then that means we should get help. So how do we diagnose autism? Like I've said earlier, these symptoms alone is not enough for you to say the child has autism. Please don't say any child has autism if you are not the professional. Leave that assessment to professionals to do. You can only suspect that a child has autism. And for parents, if you think your child has autism, you can actually do some screening. We have a free screening tool online. We call it modified checklist for autism in toddlers, modified checklist for autism in toddlers, or MCHAT for short. So you can go online, go to Autism Speaks website, or just go to Google and type MCHAT autism screening. It will bring out that question for you. You just answer 20 questions and it will tell you whether your child is screening for positive or your child is not screening for autism. If your child is having a score more than 2, that is concerning. That means the child 3 to 7 is moderate, 8 and above is high. That child needs to have an autism assessment. So, and this is done by professionals like developmental pediatricians, child psychiatrists, psychologists, speech therapists. Sometimes we do it separately, sometimes we do it together. So the diagnosis of autism is not like malaria or, or X-ray test. There's no blood test for autism. There's no X-ray. There's no scan. We have to see the child. We have to look for all those what we call diagnostic criteria from what parents have told us and from our own observation. And we need to see that the child is ticking enough boxes according to the number of boxes the child has to tick for us to give the diagnosis. So we have what we call the DSM-5 diagnostic criteria for autism. So when we see the child, when you tell us the story, when we look at the child, we are looking for all those features and we're taking the one the child is doing, taking it, and the child must tick all the boxes necessary for us to give a diagnosis. So, and then we can now give a diagnosis because each child with autism is different. There is, you can, if you've met a child with autism, you've only met one child with autism. So they are all different. And like I said, children also have comorbidities. They have all the diagnoses in addition to the autism, which the specialists have to clearly write out so that they can also be addressed at the same time. Now, let's talk about how do we treat autism. Again, autism is one of those conditions that we don't have a drug or a particular treatment for. I know parents always wonder, they want to come to say, They want doctor maybe to give them something, and everything will just go away. And one of the things I normally do with parents is to actually have this conversation with you, sometimes almost 1 hour, just talking about autism, just talking about what we can do to support the child. We don't have a drug we're going to write to take care of autism, but autism can be managed. So each of those difficulties the child has, we can provide support. So a child who is not talking, we can give speech therapy. A child's behavior, we can teach them. So to give eye contact, we can teach them how to interact with other children, how to do back and forth, how to share, how to do all those things. So we deliberately teach the children those skills. Some of these skills you take it for granted in children who don't have autism spectrum disorder, but for children with autism, we have to deliberately teach them these skills. So we do it through what we call speech therapy, behavior therapy. Some children struggle with their fine motor skills, they struggle with sensory skills, they would need occupational therapy. So these are what we're known as the evidence-based management for autism spectrum disorder. I know there are a lot of people who believe in what we call or complementary or alternative therapies, and we don't recommend that because there is no evidence that they work. And I always tell parents, so I want to do gluten-free, casein-free, I want to try music. I'm happy for parents to try anything as long as it's something that is not harmful. What I always say, parents, don't, if you want to try, you can try, but if it doesn't work, at least we've told you that there's no evidence that it works. But don't do things like giving your child chelation therapy, things that will make the child sick, things that will make things worse. In conclusion, autism is very common, and children with autism, they have different challenges which we've talked about, but we don't know the specific cause of autism. We think it's genetic with some environmental influence, but we don't also have a cure, but we have therapies that can support children with autism. The key thing is early diagnosis, early intervention, and with the right support, children on the autism spectrum can live a well fulfilling life. There are a lot of famous people who have autism spectrum disorder. We believe Isaac Newton. You may want to do more research. We believe Albert Einstein, and even contemporary people like Professor Temple Grandin. These are people with autism, and yet they are living a very fulfilling life. So autism is not all gloom and doom. Autism is always unique, totally intelligent, sometimes mysterious. So for those who have, thank you so much for listening to me. I love talking about autism, and so I just want to encourage you. The most important thing for us as parents is, if you think your child has autism, please do not hide the child away and do not wish it away. I saw one mom as at yesterday or 2 days ago telling us their child is having symptoms, and I think a doctor has even told that the child may have autism, but mom said, oh, she doesn't believe the child has it because mom is still in denial about it. But she was telling us everything, and I'm like, oh, the doctor is right actually. And I like, saying you don't agree or wishing it away, it's not going to change anything. The child still has the autism, but the most important thing is for you to get the child help. And early help works. I've seen some of my children after we diagnose them with the right support. Sometimes if they don't tell you they have autism, you will never know because they're doing so well, going to school, they don't need any extra help. That is level 1 of autism. But there are children who need help even in school, and there are children who will need help for most of their life, daily living. So it is different levels. But the conclusion we all know is that the earlier we make a diagnosis and the earlier we start giving the children intervention, actually before the age of 5, when their brain is still plastic and there's still lots of adaptation that can happen, the better for the children. So April is Autism Awareness Month, and what I've been doing today is talking to us about autism spectrum disorder, helping us to know what autism is, how to recognize autism, what causes autism, how do we diagnose autism, and the intervention available for children on the autism spectrum. So if you have any questions about autism, please post it on Ask the Pediatrician Facebook group or email me at drbimisala@askthepediatricians.com, and we'll try and answer them. So I want to really say thank you so much for listening to us. And hopefully we'll come again another time to discuss another very important topic as relates to the death of our children. I want to encourage you to please keep watching, keep sharing our videos, and I'll see you same time next week, same platform. Have a wonderful day. Bye. And remember to support and be supportive of people on the spectrum. Don't stigmatize those on the spectrum, and rather be a voice, rather add color to the life of those with autism spectrum disorder. Thank you. Have a wonderful day. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.